how we can develop.
Whenever you're ready.
Okay. I did my presentation over bipolar disorder. And just a little background information. The definition of bipolar disorder is a condition in which people go back and forth between periods of very good or irritable moods and depression. The mood swings between mania and depression can be very quick. Borderline personality disorder is the most common personality disorder in clinical settings and cause marked distress and impairment in social, occupational, and role functioning. And
Do you mean bipolar or borderline? Bipolar?
I meant bipolar.
Okay.
No, I'm sorry.
I'll just double check.
Sorry, I don't know why.
No, you're all right.
Anyways, okay, so bipolar disorders are associated with high rates of completed suicide and are common among patients with mood disorders and eating disorders. In the etiology, it is in most people with bipolar disorders, there's no clear cause for the manic or depressive episodes, and even though the exact cause is unknown, it occurs more often in relatives of people with bipolar disorder. And originally, predominant influence of genetic and family history were the essential etiology markers. It is clear that psychological factors and processes are equally important for providing a coherent and comprehensive understanding of the etiology of bipolar disorder. And the illness is biologically based and is one of the leading causes of disability in the world. So moving on to prevalence. The prevalence and incident rates of bipolar disorder are growing rapidly, especially among children and adolescents. Bipolar disorders being diagnosed and treated in youth have more than doubled in the last 10 years. And bipolar disorder have a lifetime prevalence rate estimated between 1.9% to 3.9%. And in general, the lifetime prevalence rate of bipolar disorders are 2 to 18 per 1,000 populations that were found worldwide. And bipolar disorder has a lower prevalence rate than any other common psychiatric disorder. And the annual incidence rate for bipolar disorders vary from 10.8 to 20.8 per 100,000 in a population. And the bipolar disorder is marked by moods varying from extreme highs, which is the mania, to extreme lows, the depression, and is often associated with anxiety disorders, self-harm, suicide attempts, and suicides. People with bipolar disorder type 1 have had at least one manic episode and periods of major depression. In the past, the bipolar disorder type 1 was called the manic depression. And people with bipolar type 2 disorder have never had a full mania. Instead, they experience periods of high energy levels and impulsiveness that are not as extreme as the mania. And these periods alternate within episodes of depression. There's a milder form of bipolar disorder, and it involves less severe mood swings. And people with bipolar disorder type 2 or the more mild form may be wrongly diagnosed as having depression. The manic phase may last from days to months, and the symptoms for bipolar disorder include easily distracted, little need for sleep, poor judgment, and poor temperament control, and reckless behavior, binge eating, drinking, and spinning sprees, and as you can see, there's more. And there is a high risk of suicide with bipolar disorder, as stated before. And sometimes the two phases overlap. The manic depressive symptoms may occur together or quickly, one after another, and this is called a mixed state. And also, I found this interesting, weight gain has been suggested to result from patients spending more than half of their time in depressive phase or with depressive symptoms of using alcohol or inadequate medical care. And so the treatment, symptoms of bipolar disorder are now considered to be fairly easily managed through the use of medications such as lithium, but this wasn't always the case. And prior to the mid-1980s, bipolar disorder was considered not only to be a chronic mental disorder, but also a very debilitating one. And according to the results of a study in Health Maintenance Organization enrollees, the treatment prevalence rate of bipolar disorder was 0.42%. And so the main goals of the treatment for bipolar disorder is to avoid from moving from one stage to another and avoiding the need for a hospital stay and helping the patient function as well as possible between the episodes that they're in and prevent self-injury and suicide and make the episodes less frequent and severe. The healthcare provider will first try to find out what may have triggered the mood episode, and the provider may also look for any medical or emotional problems that may affect the treatment. And some drugs that are mood stabilizers are usually the first in the treatment. And as you can see, those are the types of mood stabilizers that are used. Also, electroconvulsive therapy uses an electrical current to cause a brief seizure while a patient is under anesthesia. There's also transcranial magnetic stimulation, which uses high-frequency magnetic pulses to target affected areas of the brain. Support programs and therapies help the patient with coping with the symptoms. And bipolar patients are treated with mood stabilizers, atypical antipsychotics, and sometimes with antidepressant agents for many years. Also, aging can be a factor in the levels of medications prescribed to the people with bipolar disorders, which can require a low dosage and closer monitoring than in younger counterparts due to the side effects that may increase with aging. And the physical changes associated with aging combined with long-term lithium treatment may have adverse effect on the overall health of bipolar disorder patients, and in severe cases may result in cognitive problems, diabetes, and failure among side effects. In terms of aging with women suffering from bipolar disorders, studies suggest that sex hormones are very likely to play an important role, and 12 out of 22 women with bipolar disorders were premenopausal or postmenopausal reported worsening moods when treated with sex hormones. And more than half of all patients with bipolar disorders did not obtain treatment for the first 5 years after they experienced their first symptoms, and on average did not receive the correct diagnosis until 8 years after they first sought treatment. With some patients with bipolar disorders, did not receive any treatment or adequate treatment. And most patients with bipolar disorder go years before receiving an appropriate diagnosis and starting mood stabilizers. Any references?